السلام عليكم ورحمة الله وبركاته. مرحبا بكم في مركز أدفانس بيتنا الثاني. زي ما عارفين مركز أدفانس يعنى بالتدريب المهني لخريجي مختبرات الطبية. واحدة من نشاطاتنا زي ما انتم شايفين المسابقة دي، عندنا نشاطات أخرى بنجهز طلبتنا لامتحان ASCP اللي هو الرباط الأمريكي، وهو أول مركز في السودان يقدم خدمة زي دي. زي ما عارفين الرباط الأمريكي شهادة معترف بها في أنحاء العالم وشهادة معتبرة، فالمركز يعنى في تقديم هذه الشهادة. طيب مسابقتنا الليلة الرابعة بين جامعة الرباط وجامعة الزعيم الأزهري. هنقوم بس نراجع الرولز حقت المسابقة. عندكم دقيقة ونص للسؤال، إذا ما جاوبتوا في خلال الدقيقة ونص تعتبر الإجابة خاطئة. المراجعة اللي اديناكم لها الثلاث مراجع هي المراجع المعتبرة، والإجابة اللي فيها تعتبر الإجابة الصحيحة حتى لو اختلفنا معاها. قد يكون عندنا اختلاف في طريقة السؤال أو في الإجابة عنه، لكن عشان يكون عندنا مرجعية حاسمة وظاهرة فالإجابة في الكتاب هي الإجابة المعتبرة والمعتمدة. بنسأل الجمهور الكريم إنه يتعاون معنا بالصوت، فما دايرين انكم تضروا ناسكم بإنه تتكلموا أثناء ما هم بيتناقشوا، لأنه هنقوم نفتكر إنه بيتغششوا فيهم ولا حاجة. فالهدوء التام إذا سمحتوا أثناء ما الطلاب بيتناقشوا. طلبتنا المشاركين لو سمحتوا بطاقاتكم قدامكم. دكتور الطبية عايزة واحد متبرع من الجمهور يا اخواني يجيني هنا قدام لو سمحت. تفضل. دي الجرعة هنشوف بيها الفريق اللي هيبتدي لنا الليلة منه.
ضحى محمود جامعة الزعيم.
شكرا يا ضحى. ضربة البداية حتكون لجامعة الزعيم. زي ما عارفين عندنا 5 كاتيجوريز. الفريق اللي عليه البداية وعليه السؤال بيختار الكاتيجوري اللي عايز يتسأل فيها. فبسم الله نبدأ. جامعة الزعيم الأزهري عايزين يأتوا كاتيجوري هيماتولوجي. Microangiopathic hemolytic anemia is characterized by A. Target cells and cavernous, B. Toxic granulation and belly bodies, C. Bebenheimer bodies and basophilic stippling, D. Schistocytes and nucleated RBCs. D. Schistocytes and nucleated RBCs, and that is correct. جامعة الرباط. Alcoholism, liver failure, and hypoxia induce acidosis by causing A. Increased retention of PCO2, B. Loss of carbonic anhydrase, C. Depletion of cellular NAD+, D. Increased excretion of bicarbonate. C. Depletion of cellular NAD+, and that is correct. جامعة الزعيم مايكروبيولوجي. on Tinsdale agar, colonies of Corynebacterium diphtheria are characterized by the observance of A. Liquefaction of the agar surrounding the colonies on the medium. B. Opalescent colonies with a white precipitate in the surrounding agar. C. Black colonies on the culture medium surrounded by brown halos. D. Pitting of the agar medium surrounding the colonies. C. Black colonies on the culture medium surrounded by brown halos, and that is correct. الرباط. A sputum specimen from a patient with a known Klebsiella pneumonia infection is received in the laboratory for fungus culture. The proper procedure for handling this specimen is to A. Perform a direct PAS stain. If no fungal organisms are seen, reject the specimen. B. Include media that have cyclohexamide and chloramphenicol added to inhibit bacterial organism and saprophytic fungi. C. Incubate culture tubes at room temperature in order to inhibit the bacterial organism. D. Reject the current specimen and request a repeat culture when the bacterial organism is no longer present. B. Include media that have cyclohexamide and chloramphenicol added to inhibit bacterial organism and saprophytic. Which Westgard multi-rule applies to a situation where one control point exceeds the mean by +2 standard deviation and a second control point exceeds the mean by -2 standard deviation? A. 1 2s, B. 2 2s, C. 4 1s, D. R 4s. D. R 4s, and that is correct. Which of the following is not correct description regarding Aromonas hydrophila? A. Beta hemolytic. B. Catalase positive. C. OMPG negative. D. Oxidase positive. C. OMPG negative, and that is correct. Which of the following is not associated with acquired reversible sideroblastic anemia? A. Lead intoxication. B. Methotrexate therapy. C. Isoniazid treatment of tuberculosis. D. Acute alcohol ingestion. B. Methotrexate therapy, and that is correct. Neisseria lactemica closely resembles Neisseria meningitis, but can be differentiated from it by its ability to metabolize A. lactose, B. glucose, C. maltose, D. sucrose. A. lactose, and that is correct. Uriplasma urolithicum are difficult to grow in the laboratory on routine media because of their requirement for A. surfactants such as twin 80, B. sterols, C. horse blood, D. ferric pyrophosphate. D. ferric pyrophosphate, and that is not correct. Correct answer is sterols. Which of the statements below regarding the TIBC assay is correct? A. All methods require the removal of unbound ion. B. All TIBC methods require addition of excess ion to saturate transfer. C. The chromogene used in the TIBC assay must be different from the one used for measuring serum ion. D. Measurement of TIBC is specific for transferred bound ion. All TIBC methods require addition of excess ion to saturate transfer, and that is correct. What combination of reagents is used to measure hemoglobin? Hydrochloric acid and paradimethyl aminobenzaldehyde. B. Potassium ferric cyanide and potassium cyanide. C. Sodium bisulfate and sodium metabisulfate. D. Sodium citrate and hydrogen peroxide. B. Potassium ferric cyanide and potassium cyanide, and that is correct. Microbiome. Nutritionally variant streptococci, NVS, require specific thiol compounds, cysteine, or the active form of vitamin B6. Which of the following tests supplies these requirements? A. CAMP test. B. Bastration susceptibility test. C. Biosolubility test. D. Staphylococcus cross-streak test. D. Staphylococcus cross-streak test, and that is correct. جامعة الزعيم Michael. All of the following are appropriate when attempting to isolate Neisseria gonorrhea from a genital specimen, except A. Transport the genital swab in charcoal transport medium. B. Plate the specimen on modified Martin MTL medium. Plate the specimen on New York City or Martin Lewis Agar. D. Culture specimens in ambient oxygen at 37 degrees centigrade. D. Culture specimens in ambient oxygen at 37 degrees centigrade, and that is correct. And that's the last question in this category. A 40-year-old female experienced a respiratory infection after returning from a visit to her homeland of China. A rapid onset of pneumonia in the lower respiratory area prompted the physician to place her in isolation. She was diagnosed presumptively with severe acute respiratory syndrome, SARS, and placed on a respirator. What type of testing should be done next to diagnose this disease? A. Latex agglutination test. B. Molecular technique and cell culture. C. Blood culture. D. Complement fixation. B. Molecular technique and cell culture, and that is correct. SARS was discovered in 2003, and it made a big stir. The reason I put this question in here is the traveling to China. We see a lot of traveling in these days to China. زمان كان السودانيز بيسافروا China just تجار، بس شايفة كل الناس بتمشي China، فنكون احنا عارفين الكلام ده لما نشتغل في المعمل. That's a possibility. Also, the coronavirus break in Saudi Arabia, and of course SARS is in the same family of the coronavirus. Which of the following platelet responses is most likely associated with a classic von Willebrand disease? A. Normal platelet aggregation to erythrocytin. B. Decreased platelet aggregation to erythrocytin. C. Absent aggregation to epinephrine. D. Decreased amount of ATP in platelets. B. Decreased platelet aggregation to erythrocytin, and that is correct. جامعة الرباط. Persistent noise from an ion selective electrode is most often caused by A. Contamination of sample, B. Blocked junction at the salt bridge, C. Overrange from high concentration, D. Improper calibration. B. Blocked junction at the salt bridge, and that is correct. جامعة الزعيم الأزهري. Yes. Although serum elevation are not generally seen in early stages, which of the following tumor markers are elevated in more advanced stages of breast cancer? A. CEA and AFP, B. AFP and CA125, C. CA15-3 and CA549, D. PSA and CA15-3. C. CA15-3 and CA549, and that is correct. About chemistry. What may be the cause of neonatal physiological jaundice of the hepatic type? A. Hemolytic episode caused by an ABO incompatibility. B. Stricture of the common bile duct. C. Hemolytic episode caused by an RH incompatibility. D. Deficiency in the bilirubin conjugation enzyme system. D. Deficiency in the bilirubin conjugation enzyme system, and that is correct. الأزهري. Chemistry. Serum and urine cover levels are assayed on a hospital patient with the following results. Serum C cover is 20 micrograms per deciliter, and the reference range is 70 to 140 micrograms per deciliter. Urine cover 83, urine cover is 83 microgram per deciliter, and the reference range is less than 40 microgram per deciliter. This is most consistent with A. Wilms tumor, B. Wilson disease, C. Addison disease, D. Normal cover levels. B. Wilson disease, and that is correct. الرباط. Chemistry. Which is the best method to diagnose lactase deficiency? A. H2 breath test, B. Plasma aldolase level, C. LDH level, D. D-xylose test. A. H2 breath test, and that is correct. الأزهري. Chemistry. This is the last question in this chemistry category. A patient's total cholesterol is 300 microgram per deciliter milligram. His HDL cholesterol is 15 milligram per deciliter, and his triglyceride is 200 milligram per deciliter. What is this patient's calculated LDL cholesterol? A. 290, B. 350, C. 200, D. 210. D. 210, and that is correct. Blood. If the patient's RBCs were tested against anti-H lectin and did not react, this person would be identified as A or NN, acquired B, OH phenotype, secretor, subgroup of A. D subgroup of A, and that is not correct. It's OH phenotype, which is Bombay, called as Bombay. الزعيم الأزهري. Which results would be expected for the prothrombin time, PT, and activated partial thromboplastin time, PTT, in a patient with polycythemia? A, both prolonged, B, both shortened, C, normal PT, prolonged PTT, D, both normal. A, both prolonged, and that is correct. Which of the following results is discrepant? Anti-A negative, anti-B 4+, A1 cells negative, B cells negative. A, negative B cells, B, positive reaction with anti-B, C, negative A1 cells, D, no problem with this finding. C, negative A1 cells, and that is correct. الزعيم الأزهري. Multiple myeloma and Waldenstrom's macroglobulinemia have all the following in common except A, monoclonal gammopathy, B, hyperviscosity of the blood, C, Bence-Jones protein in the urine, D, osteolytic lesions. D, osteolytic lesions, and that is correct. الرباط. A 40-year-old female patient with a history of kidney infection is seen by her physician because she felt lethargic for a few weeks. She has decreased frequency of urination and a bloated feeling. Physical examination shows periorbital swelling and general edema, including a swollen abdomen. Significant urine analysis results show the following: color yellow, appearance cloudy and frothy, specific gravity 1.022, pH 7, protein 4+, 0 to 3 WBC per high power field, 0 to 1 RBCs per high power field, 0 to 2 renal epithelial cells per high power field, 10 to 20 highlight casts per low power field, 0 to 1 granular cast per low power field, 0 to 1 fatty casts per low power field, occasional oval fat bodies. Her serum chemistries show significantly decreased albumin, increased urea nitrogen, and increased creatinine. These findings suggest which A, RT-PCR, and that is correct. الزعيم الأزهري. How are cytotoxic T cells and natural killer cells similar? A, require antibody to be present. B. Effective against virally infected cells. C. Recognize antigen in association with HLA class 2 markers. D. Do not bind to infected cells. B. Effective against virally infected cells, and that is correct. الرباط. What is the minimum requirement for performing QC for a total protein assay? A. 1 level assayed every 8 hours. B. 2 levels assayed within 8 hours. C. 2 levels assayed within 24 hours. D. 3 levels assayed within 24 hours. B. 2 levels assayed within 8 hours. That is not correct. 2 levels assayed within 24 hours. So the minimum standard universally or in the developed world is 2 levels assayed within 24 hours. Except if you have a big hospital, most labs will do more than that. Will do 2 levels assayed within, or 3 levels assayed within 24 hours or 8 hours. But this is the minimum standard. You have to do 2 levels within 24 hours. الزعيم الأزهري. The precision of an instrument is validated by A. Monitoring normal and abnormal controls. B. Performing serial dilutions. C. Processing unknown specimens. D. Running the same sample multiple times. A. Monitoring normal and abnormal controls, and that is not correct. By precision. By precision, you want your instrument to give you the same result each time you run the same sample. جواب الرباط. سؤالكم. How is HLA typing used in the investigation of genetic diseases? A. For prediction of the severity of the disease. B. For genetic linkage studies. C. For direct diagnosis of the disease. D. Is not useful in this situation. B. For genetic linkage studies, and that is correct. الزعيم الأزهري. When hazardous chemicals are transferred from the original appropriately labeled container or containers to a secondary container for immediate use by the person performing the transfer, it A. Must be labeled with an emergency response phone number. B. Must be labeled with the identity or content of the hazardous chemicals. C. Must be labeled with hazard warnings related to the effect on involved target organs. D. Does not require labeling. D. Does not require labeling, and that is correct. A new standard calibrator has been prepared in error at a lower concentration than that required for the test. How would such an error appear on a quality control chart? A. Upward trend. B. Upward shift. C. Downward trend. D. Downward shift. 15 ثانية. D downward shift and it is